So now let's talk about some of the relationship here between the nerves and the skull foramina. So the facial nerve, we mentioned, it does motor to the facial muscles, so muscles of facial expression. So this allows us to do things like smiling and frowning and puffing out the cheeks and so on, as well as some of the taste. So some of the innervation to the taste, specifically the anterior part of the tongue, and as well as some of the glands as well. So the salivary glands and the lacrimal glands. The facial nerve travels through the facial canal, which is not a foramen that we spoke about, but it is a foramen that's found in the skull. And that is how the facial nerve exits the brain and exits the skull. Then we've got the vestibulocochlear nerve or cranial nerve 8. This is responsible for hearing as well as balance. This travels through the internal acoustic meatus. The facial nerve, parts of it does travel through the internal acoustic meatus as well. And so you can see both of these nerves associated with that opening, the internal acoustic or internal auditory meatus. And then finally, the glossopharyngeal nerve or cranial nerve 9, we said was responsible for the taste at the back of the tongue, as well as sensation in the neck and sensation in the throat or pharynx. And that actually goes through the jugular foramen. Okay, we talked about the jugular foramen in one of our earlier skull lectures as well. Okay. The last set of nerves here are 10, 11, and 12. So the vagus is 10, the hypoglossal 11, and the accessory or spinal accessory, it's sometimes called, is cranial nerve 12. The vagus nerve, responsible for lots of things. We'll talk about it extensively throughout the rest of the semester. It's going to be a parasympathetic nerve. It controls everything from the thorax, the abdomen, parts of the gut or the GI system, heart, lungs, the pharynx, the laryngeal muscles as well. So we'll talk about the vagus nerve quite a lot. Then we've got the accessory nerve. This innervates the sternocleidomastoid, one of our neck muscles, as well as the trapezius, one of the upper back muscles, and that is cranial nerve 11. And finally, we have the hypoglossal nerve traveling through the hypoglossal canal, and that is responsible for movement of the tongue. So actually moving the tongue is innervated by the hypoglossal or cranial nerve 12. So here's a nice overview of all of the cranial nerves. I'm sure you'll hear a lot of different mnemonics. There are a couple of different ones. I don't have any that come off the top of my head, but I'm sure the TAs will recommend a few to help you associate the order of the nerves. So if you can think about a way to number the nerves from 1 to 12 and associate it with a location, that's going to be one way of actually remembering which nerve is where, and also a little bit about the function, which nerve is responsible for what, okay? So be on the lookout for, interesting ways, tips, trips, mnemonics, rhymes that can help you make this a little bit simpler.